A very good day, everyone. My name is Hui Yin, and I'm a foundation student in UPM. Due to the COVID-19 pandemic, people are required to reduce outdoor activities and are encouraged to stay at home instead to stay healthy. Consequently, people tend to panic for being unable to consult a healthcare professional for advice due to hospitals and clinics are always crowded and therefore are high-risk places. As a result, some doctors had implemented virtual health communication via social media platforms to educate the public regarding how to maintain our health during these difficult times. Today, I'm going to talk about the effectiveness of online health communication on educating the public and raise health awareness via social media platforms. I believe that social media platforms are convenient and sufficient in providing accurate health information to the general public, as social media is widely used by individuals and business enterprises globally. Besides, social media have truly become the norm and are ubiquitous. I will be dividing this presentation into three main parts. Firstly, health communication via social media allow users to share information in a matter of seconds. Government organizations, health institutions, and public health agencies has increasingly utilized social media to improve community wellness by encouraging information sharing and making it possible for social media users to share accurate information and knowledge rapidly. The overall rate of respondents in use of social media to share health information in 2017 is 16%, which has been more than doubled compared with the rate of 6% reported in a research conducted by Pew Internet and American Life Survey in 2009. Sharing news via social media is the most Sharing news via social media regarding latest outbreaks or health hazards is the most effective way for healthcare communications for healthcare professionals to provide accurate information swiftly to patients without face-to-face interactions. For example, healthcare organizations such as the World Health Organizations, WHO, can share the latest guidelines and standard operating procedures via social media platforms such as Instagram and Facebook to the general public instantly during this COVID-19 pandemic. Consequently, people can implement simple practices anywhere and anytime, such as wearing a face mask when going outdoors, therefore reducing the infection rates of COVID-19 virus and achieve the healthcare system's desired target. We've looked at how social media serves as an efficient information delivery tool to all social media users. Now let's move on to the next point. Secondly, health communication through social media allows effective communication during times of crisis. A study has shown that most people nowadays update themselves with the daily news using social media platforms instead of using traditional ways such as the newspapers, televisions, or the radios. For instance, as the COVID-19 situation worsens, people turn to government health officials to look for latest instructions and guidelines. Hospitals and other health organizations are able to deliver real-time updates on hospital capacity, operation status, and emergency room access to the public via social media. This minute-by-minute information is crucial, for a minute is all it takes for life and death. During times of crisis, a reliable and consistent source is a critical resource for everyone to depend on, as shown in the study conducted by the National Library of Medicine, NCBI. The use of social media for exchanging medical information with a healthcare professional and communicating with them had almost doubled from the year 2013, which is 2%, to 2014, 3.8%. Hence, people can gain some form of reassurance, and they are able to think, act, and make the best decision wisely for the sake of their own health after obtaining valuable advice from an expert, although through a social media platform. I've talked about how social media promotes two-way communication between the public and healthcare professionals during critical times. So we'll move on to the next idea. Thirdly, health communication via social media encourages patient engagement in taking care of their health. This is because some healthcare issues are more private and patients will feel embarrassed to discuss about it with their doctors. For example, according to the American Sexual Health Association, ASHA, only 12% of young people said they had been tested for the sexually transmitted disease in the past year. However, more than half of the STDs actually affected people ages between 15 to 24. ASHA wanted to encourage this particular age of group to view STD testing as a normal part of maintaining their own health. Hence, they created a healthcare social media marketing campaign. Consequently, it drove a large number of visitors to the campaign's clinic located. In other words, social media actually affects people's actions drastically, and it showed that people took real initiatives and responsibilities towards their own health after engaging themselves in the information available on social media platforms. A present study indicates respondents who use social media in health communication for exchanging medical information with a healthcare professional may have better knowledge and rational beliefs about cancer prevention than individuals who do not use social media for this purpose. This indicates that patients who constantly engage themselves in conversations with doctors via social media are more aware and knowledgeable about physical and mental health well-being because they take actions and initiatives to improve and expand their horizons in the medical field. To sum up, health communication via social media attracts people's interest in taking care of their health and therefore improves quality of their lifestyle and contributes to the overall healthcare system. In conclusion, health communication via social media is effective in educating the public in three ways, which include sharing accurate health messages, enhancing the mutual connection between patients and doctors, and lastly, fostering patients' commitment to being passionate about basic healthcare tips. So, instead of using social media for useless chatting and endless stalking, we should utilize it to the maximum potential by following credible sources for obtaining accurate and up-to-date information from time to time, especially regarding the healthcare and medicine field, to make sure that we are always knowledgeable and responsible on our own health. Thank you for lending me your ears and have a nice day.